All right. Hi, I'm Siobhan Sarna, and I have Alicia Galvin with me today. She is going to be talking about this most important nutrient that I actually hope a lot of you are taking, which is D3, but are you taking K2 with it? So, you know, a lot of us think, oh, we have to take D vitamins, right? Like, oh yeah, I'm on D vitamins, but something can go terribly wrong, not to scare you, if you're doing D3 without K2. And I lead to my friend, Linda, who got a notification like, hey, I'm your kidney stone doctor, and I think your kidney stones are okay, but in that scan, I happen to see your arteries and they look like bone. So please go to your cardiologist. Well, Linda had been on calcium for a really long time without K2, without D3. And the theory was that the calcium had actually made it into her arteries instead of her bones. So what we're going to learn about today is your body, your mind, hopefully boost your spirit, but also really explain how D3 and K2 work together to go to the right place in your body. Also, when I have so many naturopathic friends, and whenever I'm getting a cold or whatever, I'm like, oh, what should I be doing? And almost every single one of them says, are you doing enough D3, K2? Because of its immune benefits. So that's a little backstory. Alicia is a very special teacher for us. She is part of the education team also at Microbiome Labs. She is a registered dietitian. She also teaches people about gut conditions and other trainers and teachers and healers about these conditions. My name is Siobhan Sarna. I founded SIBO SOS as well as Chronic Condition Rescue. I've done 11 summits on similar topics, also to fascia and liver and gallbladder and lymph and IBS, of course, in the microbiome. So if you're just meeting us for the first time, we're here devoted to you to help you really up-level your health and be more educated. And these are the conversations that are not happening in typical doctor's offices. By the way, I am pro-doctor, I am pro-practitioner, and I am pro-training. So you'll never hear me slam someone but I always say, well, I wonder if they're up on the latest research, and encourage everyone to do just that. So with that, thank you. Remember, if you have any questions, put them in the Q&A box. We're going to stay out of the chat unless you have a tech issue, in which case Clarissa can help you. And with that, tell us a little bit about yourself and let's dive in. Thank you. And I'll let you just take over the screen.
Yeah, for sure. Well, thank you very much for that introduction. Thank you all who are here live or if you're watching the recording. As Siobhan said, I think this is such an important topic because it's something that really isn't talked about much in the dietetic space or even in the medical space, but it's something that really impacts all of us. Because vitamin K2, as you'll see, influences anything from not only bone and cardiovascular health, but also diabetes and insulin resistance and nerve health and muscle health and mitochondrial health. And so it expands well beyond the well-documented bone and cardiovascular health. It expands into other areas of our health as well. And so let's get started. And I'll get my slides up here so that we can discuss this. Maybe you're taking it. Some of you may be already taking a vitamin K2. I will talk about the different forms of K2. You have two, MK4 and MK7. So I'll discuss that as well. But we'll be really diving into the science here and really the research. And I'm hoping that you find some little pearls and tidbits that are helpful for you. We will talk about vitamin K2 insufficiency and how to recognize the symptoms. We'll talk about how it impacts all these different areas of our body and then how it impacts cardiac output and athletic performance. So first, I want to talk about the differences between K1 and K2, because when you hear about when a doctor, somebody usually references vitamin K, they're usually referencing vitamin K1, which we as humans are not able to manufacture. We have to get this from our food. And so vitamin K1 comes from plants. So this is when you think of your green leafy vegetables, that's vitamin K1 because it's bound to the chloroplasts and chlorophyll. And so that's why we think green leafies or our green vegetables. Vitamin K1, about 10 to 20% of what we consume actually gets into circulation. And vitamin K1 has more of a role in the liver, and it helps with that clotting. So if we get a cut, we don't bleed out. And so K1 is more about the clotting factors in our body. Now, K2, we can make that through our gut bacteria. There are some food sources, specifically natto, which is a very commonly eaten food in places like Japan and other Eastern cultures. Not a lot of I mean, maybe you are eating natto, and if you are, kudos to you because you're eating one of the best food sources of vitamin K2. But really, for the most part, most of us are going to be relying on our microbiome to be making K2 for us. And there are two forms, as I mentioned. You have MK4, which is primarily in the liver and the brain, so like your organ meats of animals, a little bit in grass-fed beef, butter, and eggs, but really not much. You're not going to really fulfill all of your vitamin K2 needs through just eating beef, butter, and eggs. And then you have vitamin K7 or MK7, which is what's made by our gut bacteria. It is, as I mentioned, going to be in some of the fermented products, so natto, fermented cheeses, putrefied fish meal. Nothing that most of us are probably eating a whole lot of because they're, an acquired taste. But yes, our gut microbiome does make it. Now, what causes you to have a K2 deficiency besides maybe not consuming enough? Well, overprescribing or taking too much calcium. We're going to talk. I have an image that we're going to walk through that'll explain the relationship between calcium, vitamin D, and K2 and how they have to work together to make sure that everybody's getting in the right places that they're supposed to get in the body. So if someone's taking a lot of calcium without balancing it with vitamin D and K2, that's what can then lead to, as what Siobhan was alluding to earlier, of having those calcium deposits in the arteries, but it can also drive K2 down. Also overprescribing vitamin D without K2, that also is another issue, and we'll talk about that. Statin drugs can cause a vitamin K2 deficiency. We know that statin drugs affect the HMG-CoA, which has a down trickle effect through several complex enzymatic processes. The down trickle effect of what the statin drugs do is it affects the enzyme that actually helps with making K2. So statin drugs can also deplete K2. If you have dysbiosis, so if you have a microbiome that's really depleted in your beneficial species, then you're going to affect how well your microbiome can make K2 for you. So if someone's eating a lot of processed food, if they've been on a lot of antibiotics, or if they're consuming a lot of foods that have food preservatives, that will also affect it. So what would be some of the symptoms? Well, if someone had, because K2 plays a role in maintaining bone health, if you have someone who has weak or brittle bones, they're breaking bones a lot, they have osteopenia or even osteoporosis, that could be deficiency. If they've had a coronary calcium score, which is probably what Siobhan's friend went and had and saw that her arteries were pretty full of calcium. That calcium buildup can be a sign of deficiency. If they struggle with any sort of cardiovascular concerns, if they're struggling with decreased cognitive function, muscle cramping, insulin resistance, and also we'll talk about like diabetes and how that's involved. So essentially, subclinical vitamin K, or in this case, vitamin K2 insufficiency, is very widespread, about almost 100% of the population, especially westernized populations. Not as much in some of your Eastern cultures where they're eating a lot of that natto, but definitely in the westernized world. It's a very, very common insufficiency or deficiency. And because vitamin K2, when we think about what it can help, like diabetes, cardiovascular disease, when we think about some of the really the public health issues that we see a lot of in a westernized world, we can say that possibly K2 intake and improving K2 intake could influence life expectancy as well as quality of life. So we're going to go through this. As you can see, these are sort of the four areas: muscle health, nerve health, cardiovascular health, and bone health. Because vitamin K2 plays a role in something called the carboxylation cycle. You don't have to memorize that word. I'll break it down for you. But also the redox cycle, which is where it plays a role in ATP and VO2 max. So this is basically what's going to summarize the conversation we're going to have today. And I'll walk you through each of these and show you some studies and some research on what K2 is doing in each of these elements. So I think this is a really nice visual. It summarizes K2's roles and how it helps with rescuing mitochondrial function. It helps with increasing ATP production. It acts as an electron transport donor. It helps with vascular health. It's even been linked with improving and helping with things like cognition and Alzheimer's disease. It's been looked at in the multiple sclerosis or MS and certain neurodegenerative diseases. Helps with neuroinflammation, with decreasing some of the inflammatory byproducts that are made. And then also it helps with, as an antioxidant, decreases reactive oxygen species. It can help with increasing glutathione, and it can play a role in apoptosis. So these are just the different areas beyond just bone and cardiovascular health that it can actually help. So how does it do its magic? Well, there are 3 proteins that are in our body that are inactive naturally. So matrix GLA protein, osteocalcin, and Gas6. So these are 3 proteins that exist inactive in our bodies. Well, then in comes K2. K2 helps to basically, it serves as a cofactor for an enzyme. So it supports an enzyme that then activates these proteins. So the only way that these proteins get activated is through K2. So matrix GLA protein plays a role in preventing arterial calcification. So it prevents the buildup of calcium in the arteries. Osteocalcin plays a role in bone formation and making sure that calcium actually gets to the bone, not in the soft tissues. And then Gas6, which plays a role in neuroinflammation. So this is how K2 is really doing its magic in all these different areas. And it's only K2 that can activate these proteins. There's no other nutrient that can do this. So let's go through the schematic. Starting with vitamin D. So as Siobhan was alluding to earlier, if you are taking, or if you have a friend or a family member who is just taking vitamin D, they heard about it on, wherever, or their doctor told them to, or they were vitamin D deficient, and they just started taking a lot of vitamin D without balancing with K2, that can lead to problems. And the reason for that is vitamin D activates something called your osteoblasts. Osteoblasts are the bone cells that help to build your bone. So think about osteoblasts with a B, they build your bone. What these osteoblasts do when they're stimulated by vitamin D is they release uncarboxylated osteocalcin. Basically, that means they're releasing a bunch of inactive osteocalcin. So vitamin D causes your bone cells to release a lot of osteocalcium, but it's not active. So if it's inactive, it can't put calcium in the bone. So it doesn't do you much good to have a bunch of this osteocalcin circulating if it's inactive, because it can't actually do its job. The only way that you then activate it is through K2. So if you have K2, that then will activate your osteocalcin. And that osteocalcin then serves as like a taxi that then ushers calcium from circulation or, to the bone, to make sure that you're getting calcium where it goes. So if you have someone who is taking vitamin D and calcium for bone health, and those are the only 2 nutrients that they are taking, you do run a risk of having a buildup of calcium in the arteries, because you have all this extra calcium. You have all of this osteocalcin circulating that's not active, and you have no place for that calcium to go. It doesn't know that it has to go to the bone because it doesn't have that taxi that's ushering it to where it needs to go. Now, on the flip side, you have this matrix GLA protein. So vitamin D also will activate the inactive form of matrix GLA protein. That matrix GLA protein, if it's inactive, cannot prevent arterial calcification. So the role of this MGP is to take that calcium that might be depositing in soft tissues, and it redirects it towards the bone. So it prevents that arterial calcification. And again, you have to have vitamin K2 to do that. So this is why you never want to take vitamin D and or calcium when it's unbalanced with vitamin K2, because then you get a whole bunch of buildup of these inactive proteins, and they're not able to really do their job and direct that calcium where it needs to go to the bone. So you're not really going to be helping to build your bone. That calcium can't do its job without K2. So that's the dynamic of these 3 nutrients. So if we go from bone and sort of cardiovascular health and we switch over to thinking about nerve health, this is where peripheral neuropathy has had quite a bit of research with K2 as sort of a driver for that. And there's typically three different types of peripheral neuropathy. You have a peripheral neuropathy that comes from diabetes. You have a peripheral neuropathy that comes from what's called megaloblastic anemia, which is essentially a B12 deficiency, or multiple myeloma. We're going to be focusing today mostly on diabetes and B12 deficiency. And the reason why you get peripheral neuropathy is you get what's called a demyelination of the nerve fibers. And what demyelination means is it's just this deterioration of the nerve, the structure and kind of that nerve sheath that circulates the nerves that prevents all that pain and activation. And that's what causes peripheral neuropathy. So it's this demyelination. We'll circle back to this topic when I talk about K2 in a minute, but those are the three areas that you typically would see it. Now, just to lay a landscape around diabetes and peripheral neuropathy. So it's essentially when someone has diabetes and they start to have a lot of these signs and symptoms of nerve dysfunction, and they don't have any other cause. They don't have B12 deficiency. They don't have multiple myeloma. They don't have an injury. It strictly is coming from their diabetes. And there's an estimated prevalence of about 28% of those who have diabetes, those adults who have diabetes within the United States. And we know that diabetes is an epidemic, that currently there's about 350 million people worldwide who have diabetes, but that's expected to increase significantly by 2030. And one of the most common treatment methods is metformin, which is sort of a double-edged sword, because while it is used to treat diabetes and has been shown to be very helpful with insulin sensitivity, it can worsen peripheral neuropathy because it actually will deplete B12. So you're sort of making something worse if they already are struggling with peripheral neuropathy. And so it can be devastating. About half of people with diabetes will develop a full ulcer. Diabetes itself is a leading cause of lower limb amputation. It can lead to decreased quality of life, falls, depressive symptoms. So we really want to do everything we can to prevent that progression. So this is how K2 then can integrate with diabetes. There was a 10-year study of almost 40,000 Dutch people between the ages of 20 and 70, and those who had the highest intake of vitamin K2 were 20% less likely to develop type 2 diabetes than those who had the lowest intake of vitamin K2. And for every 10 microgram increase in vitamin K2 intake that they had, there was a decrease in developing type 2 diabetes. And they were consuming around anywhere between 250 to 360 micrograms a day. And so the higher the intake, the lower the diabetes risk. And because vitamin MK7 or K27 does reduce the progression of insulin resistance, and it can improve insulin sensitivity through actually the same osteocalcin that is involved in bone health. There's a mechanism that it has that in some way helps with that insulin sensitivity in humans. And so vitamin K2 is very helpful in the prevention of diabetes. And so here, if we look at what's happening, while it is part of the bone formation, it's also part of the signaling pathway that regulates glucose metabolism. And so as we remember from the image I showed earlier, vitamin K2 inhibits the inflammatory process. And by inhibiting that inflammatory process and these various inflammatory byproducts and mediators, it helps to improve insulin resistance. So if we think about diabetes and helping with diabetes and insulin, and then also going into peripheral neuropathy, this was a study that was it was 100 patients who had peripheral neuropathy, and it was either from a B12 deficiency or type 2 diabetes. So they had peripheral neuropathy due to one of those factors. And over 8 weeks, they were given 200 micrograms of K27. And they were followed for those 8 weeks, and then they were followed up in a 12th week. And they were looking at all kinds of different symptoms: numbness, tingling, weakness, fatigue, and cramping. So you can see at their baseline, they used what's called the visual analog scale, or the VAS score, which anything above a 4 is considered a diagnosis of peripheral neuropathy. And so here you can see everybody definitely had peripheral neuropathy. It was all above 4. After 4 weeks, of that 200 microgram dose, it started to decrease. By 8 weeks, it had pretty much, for the most part, dropped below that 4. But then by 12 weeks of the K2/7 supplementation, in both groups, they were significantly reduced to just a VAS score between 1 and 2. So there was a significant improvement in their peripheral neuropathy scores after 12 weeks. And so this is just a visual of the graph that shows the decrease over those 8 weeks, and then even it continued on beyond that into that 12th week. So how does it do? How is this working with K2 in the realm of peripheral neuropathy? So this Gas6, one of these proteins that K2 has to activate, is involved with neuroinflammation. So it's involved in neuroinflammation in the brain, but also just neuroinflammation in the peripheral system as well, because it facilitates the repair of that myelin sheath that I was mentioning earlier that gets worn away when you have peripheral neuropathy. It actually can help with that repair and synthesis of it in that peripheral nervous system. Oops. And so in K2 is basically through the same mechanism. By reducing that inflammation, it can help with those neuroinflammatory mechanisms. So let's talk about muscle health, looking at blood perfusion and then mitochondrial function. So with ATP and energy production, we know that our mitochondria are often referred to as the battery packs of the cell. They are energy producing organelles within our cells that make ATP. And we know that there's a role that K2 plays in being able to increase that mitochondrial ATP production. So it acts as a mitochondrial electron transport carrier, which basically what that means is it just helps with the energy production and that energy cycle within the cell. And the cell can generate a lot more ATP, about 30 to 40% more energy when you have K2/7 on board. And so this is a really important aspect for anyone who's, aging population, definitely athletes, because with athletes, it's all about trying to improve your mitochondrial output and your energy output, that ATP production for performance purposes. And so K2 plays a big role in that electron transport chain. So VO2 max, some of you may be familiar with it, maybe some of you measure it, but it's essentially the maximum amount of oxygen that a person can use during exercise. So when we're doing intense exercise or endurance exercise, as our exercise intensity or duration increases, your cardiovascular heart output, has to match that. That oxygen production has to match the output that you're trying to achieve. And that's the limiting factor for improving performance. So if you're able to increase your VO2 max, you're able to increase that oxygen utilization. You have more efficient oxygen utilization, so you can increase your performance. And it's a really great indicator for cardiovascular fitness, especially for aerobic endurance athletes. And for all of us, it starts to decline after about age 25. And if you're a non-athlete, it'll decline about 10% every decade. So unless you're really working at it, you're going to lose it after the age of 25. And so what we can, and this was a human trial that was done looking at K2 supplementation on that VO2 max and cardiac output. It was a randomized trial. They looked for the first month, they did a loading dose of 300 micrograms. And then for the second month, they did 150 micrograms a day of the MK7 vitamin K2. And what they found was that there was a 12% increase in the maximum cardiac output, which doesn't sound like a lot, but when you put it in context, if they weren't taking that K2 supplementation, the same changes, that 12% increase, would have taken about 6 to 9 months of continuous training to achieve that same improvement. This was 2 months. This was a 1 to 4 week and then a 5 to 8 week. So by supplementing with the K2, you're reducing that training window by about 60%, which can equate to reducing it by 14 to 22 weeks. So for someone who's training for some sort of an athletic event, especially if they're an endurance athlete, vitamin K2 can be a really wonderful adjunct for them because it'll help them to achieve greater gains with their exercise activity to maintain a higher VO2 max and increase that cardiac output. So it also helps with smooth muscle differentiation. It's been studied in, looking at hand grip strength, looking at muscle or calf circumference, functional performance. It's been looked at in sarcopenia, which is essentially just an age-related decline in muscle strength. And there's actually an improved muscle strength with those who take vitamin K2. But also in cramping. So muscle health in terms of cramping outcomes has also been looked at. So this was a smaller study. It was a 19-patient study who came with muscle cramps, and they were given 100 micrograms. So for peripheral neuropathy, I'll have a dosing chart for you, but for peripheral neuropathy, it's 200 micrograms. For muscle cramping, this was 100 micrograms over 3 months. And they basically just kept a record of how often they were having their cramping, how long it was lasting, and then how intense were they. And so they were divided into 2 groups. So they had group A, which was 1 to 5 cramps per day. So pretty frequently. And then group B were having anywhere between 2 to 4 cramps per week. So one was a daily measure and then one was a weekly measure. And then they were followed up in the 4th month just to see what happened after those 3 months of supplementation. And they followed up at the 4th month, and they went through a battery of tests to look at their biochemistry. And after, though, at that 4-month mark, they, even after stopping the MK2 or the vitamin K2, they were still at anywhere between 0 to maybe 2 to 3 a month, which group A, remember, was the group that was having daily cramps, versus group B, who they were the ones that were having them weekly. They were having anywhere between 0 and just maybe 1 cramp a month. So very significant reduction, not only in frequency, but also in the VAS score, which is the intensity of that cramping and that pain. And so you can see both significantly decreased during the 3 months, and then for that 4th month after a follow-up when they were not taking the supplement. Now, we always get the question about safety. So there have been some toxicity studies done in animals, and it's been shown to be non-toxic up to 20,000 milligrams. We typically are recommending at the microgram level, so significantly lower. Usually it's anywhere between 200 to 300, maybe 400 micrograms, which is much, much, much less than that toxicity level. And the minimal lethal dose is like 200 milligrams per kilogram. So it's many exponentially greater dosage amounts in terms of toxicity. So it's a very safe nutrient to take. We also get a lot of questions about warfarin and Coumadin or any of the blood thinning medications. That has been looked at, and essentially they've looked to see that the dose of MK7 or vitamin K27 that would be affecting the clotting would be 145 milligrams per kilogram, which for an average 150-pound person, that's going to be about 9 million micrograms. Now, that being said, we do still recommend that if somebody's on warfarin or Coumadin, and if they are taking vitamin K2, we do recommend that they check a PT-INR just to be on the safe side. But there were no other major contraindications with this nutrient as of current knowledge. So essentially, it's a pretty safe nutrient to take, but definitely make sure that if you are taking a blood thinning medication, that you're talking about it with your doctor, and that you're having those measures checked. So in terms of dosing, for arterial calcification, it's about 45 micrograms is the minimum needed to help to reduce that arterial calcification, which is activating that matrix GLA protein and helping to reduce the laying of calcium in the arteries. If you're looking for improving your VO2 max, that's about 300 to 320 micrograms of K2 per day. You really don't see any improvements in cardiac output or mitochondrial health below that, so you would need to do a much higher dose. For insulin resistance or diabetes, it's anywhere between 250 to 360 micrograms. For peripheral neuropathy, it's about 200. Muscle cramping, it's 100. And the ideal ratio, so if you're looking at a vitamin D K2 combination product, you want to be getting about 45 micrograms of K2 for every 1,000 IU of vitamin D. So if a supplement has 5,000 IU in it, then you would want to make sure that you're taking about 200 to 225 micrograms of K2. So just to break down the forms again. And I just wanted to tease this out because it's important when you're thinking about supplementation with vitamin K2. So as I mentioned with K2, you have two forms. You have MK4 and you have MK7. MK7 is the natural biological form that the body can use. So that is what your body preferentially is going to use for all of these mechanisms of action that I've just gone over with you. And that's because you have what's called the trans isomer, which is the form of K2 that is that bioactive form. You also have the synthetic form. So that's the cis isomer that's inactive. A lot of your MK4s are synthetic and they're in the cis isomer. So a lot of the supplements that are on the market, if they're using an MK4, they're likely using more of that cis isomer, which is the non-biologically active form. The body doesn't really know what to do with it. We don't really know long-term with cis isomers what their effects are, if it's good, if it's bad, if it's neutral. Your body just, you're not going to get those kinds of, the same kinds of benefits as you would with an MK7 or the trans isomer of vitamin K2. So just wanted to kind of point that out because I know that's a question that people often have in terms of what type of K2 do I take. So that brings me to what Microbiome Labs uses with our vitamin K2 products is it's 100% natural. It's actually used, we make it through the fermentation of chickpeas using Bacillus subtilis. It's not a soy-based. A lot of your MK7s, even if they're natural, are fermented from soy. Ours are not. Ours are fermented from chickpeas. And we do have US FDA generally recognized as safe status for our product. So that brings me to, where do you find these naturally occurring MK7s and what would the dosages be and when would you use what over when? So I like the Megaquin D3 for anyone who has an autoimmune condition because we know that autoimmunity, vitamin D deficiency is a big part of that. Also, diabetes and blood sugar or insulin support, vitamin D can play a role in that as well. So you'd want to use that combination. Definitely cardiovascular again because of the impact of vitamin D that can also help with cardiovascular health, bone support, of course. And then just supporting low vitamin D levels, you'd want to use something that's a combination. And we do have the correct ratio. Ours has 5,000 IU per capsule, but it has 200 micrograms of the K2. So it's in the proper ratio.
Hang on for a second, Alicia. I just want to see if Clarissa can put the link in the chat. Guys, we have a 15% coupon that Microbiome Labs has graciously extended to my community. So we'll put the information, sorry to interrupt, but people are asking like, where do I get it?
Yeah,
so
for sure.
Usually you have to go through a practitioner in order to have access to Microbiome Lab products, but because of my long-term relationship and how kind they are to my community, we do have access for you. So Larissa just put it in the chat. Go ahead and check it out. I'm going to let you keep going and we'll get to some questions. So you want to order the Myomax and the Megaquin D. Okay.
Yes. Yep. So that's when you would use the D3. And then if you're looking more for athletic performance, VO2 max, your athletes, your marathon or cyclists, highly active exercisers, you'd want to go with the Myomax. That's going to be a higher 300 microgram dose per capsule of the vitamin K2 as MK7. And then it does also include a little bit, about 100 milligrams of calcium pyruvate, which does help with facilitation of the ATP cycle and helping with that energy production. So, and with that, that's what I have for you. I know it was a lot in 30 minutes, but I know we have time for Q&A, so maybe we can flesh out some questions.
Great job. Yeah. Seriously, thank you so much. And those slides are fantastic. Yeah. So I know a lot of people joined a little bit after we got started. I'm Siobhan Sarna. That's Alicia Galvin, of course. And she did a great job explaining why we all need to be taking this and in those combinations. We do have that coupon for you. It's No Bloat 15, and there's the place to register as an account and you use the patient direct code SIBO SOS. I think if you click that, it might be auto-populated for the code, but nevertheless, there you have it. And that's for anything from Microbiome Labs. So it's the entire site. It's not just these particular offerings. So that's also very, very cool. Let's get to some questions for you. Hi, Susan. Thank you so much for presenting this topic. Is it safe to take K2 if you had pulmonary embolisms? Now, of course, this isn't medical advice, and Alicia's not your doctor, but I love to have her opinion on the topic in general. Susan's asked a number of practitioners, and many don't know how to answer the question. I get that. The pulmonary embolism was a result of a shoulder surgery. No blood clots were found in my legs. You're in a very delicate situation, Susan. So
Yeah. Yeah, I would, yeah, I'd say definitely
sorry.
you'd want to check with your doctor about that. I don't know if you're on any blood thinners of any sort currently, but as I mentioned, typically K2 is fine in those cases. However, I don't want to give that medical advice without you consulting, but MK7 typically does not affect clotting as much. It would be K1 that you'd have to be more concerned with, but yes, you'd want to verify with your provider.
May have missed this, but does megaquinone, where does megaquinone fit in? If you want to pull up that slide.
The megaquin D or megaquinone the product, because we do have a
megaquinone the product, right? Okay.
Oh, okay, yeah, megaquinone the product. So yes, I didn't mention megaquinone. We do have a K2 product that's K2, but it does have K1 in it as well. So sometime, if you do have clotting issues or clotting concerns, or if you're on a blood thinner, you probably would not want to take the megaquinone because that does have the K1. And then it also has a little bit of magnesium, and it has some zinc. So it has a couple of other nutrients, but that's really more of a kind of your standalone K2 product. If you're not wanting the vitamin D aspect, honestly, I don't know anybody who doesn't need vitamin D.
Okay.
So, but yeah, if you didn't need the vitamin D, because if your vitamin D levels were perfectly fine, then you could take just the MK2.
We also do have what I call an in-webinar bonus only. So actually just going to pause the recording, but do come live whenever you can, guys. Hang on. All right. Is vitamin K1 or K2 contraindicated if you have genetic predisposition to blood clotting? I'm specifically thinking of factor V laden, but would love to know about any blood clotting genetics.
Yeah, so blood clotting genetics K1, you'd want to be cautious with that, depending on your type. Yeah, because that definitely will affect your clotting.
Melissa is eating natto every day. How much do I need each day? Good for you.
That's awesome. Good for you. I'd have to go back and look at, there was a trial that was done in Japanese women, and they were looking at osteoporosis, and they were looking at their natto intake, and I'd have to go back and look at but natto is really a super, super high containing food. I'm sure whatever you're eating is totally fine for you. It's just like eating, because the Japanese study, I mean, they were just eating kind of your normal levels, their normal amounts, normal servings.
I've never heard of natto until I met you and Kieran Krishnan. So what is it again? It's a seaweed that's fermented, right?
Well, it's actually a fermented soy product. It's
soy. Okay,
soy.
So
it's a fermented bean product that is very, very high in K2. So great for you. You probably don't need to supplement K2.
How's that taste?
Yes, it's an acquired taste, but that's so fabulous.
Polite. Very polite.
Yeah.
Is there an upper recommended limit of vitamin K2? I know Serene Skin has 300 micrograms of vitamin K2. That is higher than most other supplements. Why is the K2 at that level in Serene Skin?
So for answer to the first question, no, there's not an upper limit. It's very safe. Typical dosing is up to, you can go up to like 360 microgram dosage or 400 microgram dosages of K2. It's very, very, very safe. So there's not really an upper limit established. And then for your second part of the question, with Serene Skin, the reason why you have higher K2 in there is because vitamin K2, and we didn't talk about it today just because of time, but K2 is also involved in helping with skin elasticity. So again, if you think about the calcification in the arteries, you can have calcification in the skin. And when you have calcification in the skin, then that can contribute to wrinkles and more aging issues with the skin. So the K2 is there to help with that skin elasticity and preventing the wrinkles. So that's why you have the K2 in the Serene Skin.
Okay. And is it available in the UK? I think the answer is yes to that.
Serene Skin should be available in the UK, yes.
Is the megaquinone and the
Megaquinone is Myomax, I believe is,
Biomax,
yes.
yeah.
The only
Okay.
things in the UK that you can't get would be like any of the IgG products,
Okay.
Zimbam Dual. There's a couple in Mega Marine. There's a couple you can't, but those you should be able to get.
Okay. Let's see. Is there a problem for SIBO patients if the chickpeas are fermented? I don't personally think so. I don't think that's going to be a problem
No,
at all.
no,
Yeah.
no,
Yeah.
no.
Okay, hold on. Okay, used vitamin D3 3000 for years, never on calcium supplements or statins. So do I still need K2? So, and some of these questions were asked like only a few minutes into the webinar because
So
I think
before I got to that,
I explained the rest of that.
yeah, no. So there's a slide in there if you do, if you end up getting the slides that I was going over that, yes, your vitamin D, even if you're taking vitamin D, you're not on statins, you're not on any other thing, you're not taking calcium, vitamin D is going to still activate the osteoblasts to release that osteocalcin. So you're still going to have a lot of osteocalcin. The body will then drive down your endogenous K2 stores. So that's why if you have high inactive osteocalcin, the body goes, oh, you have all this inactive osteocalcin. We need to try to activate it. And it'll actually deplete your K2 stores. So that's how excessive vitamin D, that's part of the toxicity of vitamin D,
Yeah.
is it essentially triggers a vitamin K2 deficiency. So you'd still want to balance that.
Who should not take K2? That's a good one.
That's a good question. Um,
Any questions, please put in the Q&A box.
yeah, I don't know that
Okay.
there's anyone who really shouldn't take K2.
Okay, do
Yeah,
you need to
very
take
safe.
K2 at the time with the calcium or D3 or at least the same day to prevent calcium only issues?
Yeah, just same day. You don't have to take it at the same time.
Okay. Okay, let's see. I had peripheral neuropathy from Sojourn's lupus and was just diagnosed with osteoporosis and wondering what dosage would be appropriate. So again, that's a really very specific medical question, especially with your conditions, but what's the typical amount to
Typical
take?
dosing. I mean, I'd say, the peripheral neuropathy was the, 200 microgram dose, osteoporosis. I'd say if you're anywhere between a 200 to 300 microgram dose, you're probably good.
So how many capsules is that?
Well, if you're going to end up taking if you have osteoporosis, you'll need vitamin D. So that would just be really, 1 cap a day would get you 200 micrograms of the K2.
Can you pull up the pictures again of the products?
Sure.
Yeah.
Yeah.
What's the best test for vitamin K2? Is it a blood test?
Convention in your in the real world, there's really not. A lot of these measures are more in research settings. So can y'all see my side? Yeah, so these would be, so here's the dosing. So you've got 200 mics of the K2 with a 5,000 IU of D. So if osteoporosis or bone health or bone support is a concern, you'd want to do that. But yeah, there's not really a great way to look for K2 in the real world.
Okay. Yep. No, good, Maria. No problem. There you go. Okay. What are your thoughts on taking the doses separately, vitamin D3 from K7?
You could do that. I mean, here's the dosing just for anybody who needs it.
Thank
Yeah, you can do it separately. It really, the only reason, vitamin D with K2 product combinations are just really to kind of help reduce pill fatigue and having to take multiple things. But yeah, if you have a vitamin D and you add a separate K2, as long as you're taking within the same day, that's fine.
The slide said multiple myeloma, but she didn't
Uh-huh.
discuss this. Any benefits for those with multiple myeloma?
Yes, I didn't discuss it just for time, but there are a few studies on the peripheral neuropathy caused from multiple myeloma. And yes, K2 is supportive and helpful in that. So I just didn't include them for time purposes, but yes.
Do you have any studies, any imaging of arterial calcium plaque being reduced after K2 supplementation? I don't know if there's
Not studies, but anecdotally, I have
Okay.
people. I'd say recheck after a year. If you're going to supplement, recheck a calcium score after about a year.
Okay. Any contraindications for liver disease / cirrhosis, liver enzyme tests normal on blood work?
Again, cirrhosis. So any sort of liver, especially cirrhosis, you'd want to be careful with any supplement just because of processing through the liver. So I'd check with your provider and just make sure that and monitor your labs, make sure your liver enzymes aren't going up with any sort of supplementation.
And guys, you are all getting the replay. And if you did decide to place an order between now and 4:40 Eastern time, and you send us the receipt to info@sibosos.com, you are getting the slides, but you are also getting the replay. Okay, asked several cardiologists, gynecologists about K2. They said they don't usually recommend it even to women since no real proof it helps. Well, you just saw 35 minutes of proof. So confused why these specialists don't recommend it. I'm glad you're asking this question. Why don't specialists so if I was going to have a baby, I definitely would want to go to a gynecologist because they're an obstetrician because they are a specialist in that. And that's what they went to school for. And of course they had to, receive lots of training to be an MD in general. This is very much like what I said in the beginning. It's emerging research. It's also niche. I mean, it shouldn't be, but it is. So I can't expect any practitioner to know everything about anything and everything. So there's literally, with the explosion of this beautiful, amazing thing that we're all talking on the internet, the exponential growth of information and research being revealed, not to mention done, is glorious and overwhelming at the same time. So, that's it. So not every specialist or doctor is going to know this. As a matter of fact, I would love it if you would tell them about it. I want you to tell your friends about this. Spread the word because that's how we will get educated. When I had my SIBO test and the newest, results is back in the day, I went to my GI doctor and he goes, "Oh, thank you. They didn't teach us this in medical school. So how can I help you?" So gorgeous. He said they didn't teach me this in medical school when he went 20 years ago. Anyway.
Yeah. Yeah. And doctors, I think they get 6 hours of nutrition in their whole medical career. So there's no way to cover all the nutritional aspects. So a lot of it's just like Siobhan said, they didn't go to school to become a dietitian. They went to school to become a medical doctor. So they're going to be very well versed in all the medical things, but nutrition may not be the area that they're going to have the most background in. So
any way to check K2? Did you already say that? How do you know if you need it, if you're taking enough?
Yeah, there's not conventional there's not really great commercial testing for K2. It's more in the research setting.
If my body's intolerant to beans, do you think it's okay to use this or not? Well, are you allergic or intolerant?
Right. Yeah. No. So it's fermented from chickpeas. There's no residual chickpea fibers or FODMAPs or anything like that in the product. It's just a fermentation to get that K2. So it's not I mean, I would say if you were IgE truly allergic to chickpeas, don't take it. But otherwise you should be fine if it's just an intolerance.
Did you say that K2M7 helps with B12 levels, helping tingling of the legs, leg fatigue?
So it doesn't help with B12 levels. It helps with depleted B12 can contribute to that peripheral neuropathy. However, what K2 is doing is helping with that nerve sheath. It's helping with reducing the effects of what B12 will cause. So you wouldn't fix a B12 deficiency by taking K2, but you could fix some of the symptoms that can stem from that B12 deficiency.
Okay. Let's see. Is it safe to take it with nattokinase? I like nattokinase. I don't know what that is. What is that?
Nattokinase, yeah. It's an enzyme, it's a proteolytic enzyme used a lot in cardiovascular conditions. Yes, you can take that.
Okay. Patricia, go ahead and reach out. I'm having issues setting up the account. Do I need a patient code? Yes, it's SIBO SOS. So Clarissa can help you in the chat, but it's SIBO SOS, SIBO SOS. And don't forget to use no bloat 15. There it is. Clarissa just reposted it. Hopefully that helps. Okay. And if you're ordering, be sure to reach back out to us at info@sibosos.com so we can get you the slides. And everybody, you are getting the replay tonight. What does MENAQ mean in M7 again? Does it mean the same thing?
So are you talking about the product or here?
Again. I don't know. Retype that question if you would, please. Are you familiar with the SpectraCell tests?
Yes.
Would it show K2?
I believe they use, at least unless they've changed it, it's been a minute since I've used them, but they used to check K2. Again, I wouldn't say it's going to be the best, most validated measure of K2, but it may give you some idea, but it's
Okay. Oh, she's
not
saying
validated.
menaquinone.
Menaquinone, yeah. So menaquinone is the K2 family. So
Okay.
menaquinone, yeah. So
Are
that's the
there
one.
any K2 only supplements you're aware of? Already have vitamin D supplement I prefer to use.
Well, if you wanted to use the megaquin or the megaquinone, which is our, like I said, our K2 product, but it does have the K1. So you just need to make sure that K1 is or is not okay for you if you're having any kind of clotting issues, but that's an option. In terms of other just standalone K2 products, I'm honestly not sure on that. I haven't researched to see if there's just a K2 product.
Okay, what dosage would I take with low D labs, taking 5,000 D weekly and calcium with D daily? Plus I have osteoporosis and RA and Hashimoto's. I'm so sorry. You definitely need to get that K going.
Yes, definitely. If you're on, yeah. So again, I'm going to pull up the dosing here again, because I think that may help
And then also
some.
show the bottles, like we
Mhm.
can show, like pull that dot together.
Yeah, I'm actually just going to rearrange my slides here real quick.
Okay, great.
And I'll pull it up again.
So the megaquinone Q automatically means it has the K1 already in it with the K2.
Yeah, the megaquinone product has the K1 and the K2. Yes.
There you go. All right.
So here's the.
Patricia, Clarissa's trying to help you. Okay. All right. Okay.
So arterial calcification, bone health, a minimum of 45 micrograms, but honestly, going higher is totally fine and can be helpful. So these are the two products, your vitamin D.
And then look in the red, you guys, because that's where you can see
Mhm.
and that's what's in one cap. So K1 increases or reduces clotting? Kim just needs clarity on that.
Yeah, it increases clotting. So if you're on a blood thinner, it's counteracting what that blood thinner is doing.
Okay. All right. Any idea? Do you know Dr. Millman?
Dr. Millman.
Yeah,
I
prescribes MK2, all this stuff. I don't think we know Dr. Millman,
mm,
so I don't want to really comment on that. But looks like he's into K2, so that's cool.
great.
Help lowering 100 micrograms to 45 micrograms of M7 K2 still gave me anxiety, tachycardia, and insomnia. Took a week to resolve after discontinuing. Have you ever seen these side effects? Since I really want to be on K2, do you have any recommendations on how to use it or tolerate it? Well, definitely don't do it if it's doing that to you.
Yeah, definitely don't take it. I mean, I wouldn't say that's a common thing. I can't say that it wouldn't be possible. I mean, maybe for whatever reason, again, I don't know your history and what's going on with you from a gut metabolism genetic standpoint, but yeah, just don't take it if it's causing you to have those issues. I mean, maybe try some natto. I don't know, maybe try the food-based way.
That's what I was going to say. So I hope we clarified about the K1 is the clotting issue. Can you take K2 if on blood thinners?
So as I mentioned, in theory, technically from safety data, K2 should not affect blood clotting. But if you are on a blood thinner and you are taking K2, just make sure you tell your provider and that you are getting PT-INR checks to make sure that it's not affecting your clotting.
Yep. Do you know what Pradaxa is? PRAD, like Prada XA?
Mm-mm.
But we don't know that one. Okay. Let's see. The dosing chart is in, we've gone back to that a couple of times. We talked about taking them together or apart and the ratio. Maria, I don't know. We ask your doctor and take this, buy something from Microbiome Lab, send us the receipt, and then we'll get you the slides so you can take that with you or watch the replay and just look at some of the studies and references. Okay, so you can walk in, like I walk into the doctor's office when I needed to with studies in my hand and be like, hey, isn't this cool? And then we had a great conversation. Okay, let's see. Take them daily. Take them daily.
Mm-hmm.
Yep. And Myomax doesn't contain D.
No,
Okay, true. That's a true statement.
true.
Yeah. Artie, I've been taking 45,000 micrograms for osteoporosis because I heard high vitamin K is helpful. However, I noticed source is MK4. So I just threw out the bottle. What do you recommend for osteoporosis?
Yeah, so that's the other thing is you will see much, much higher dosage of MK4, like the 45,000, 2,000 micrograms, because it's not as bioavailable and it has a much shorter half-life. So you have to take a whole lot more often to get any kind of benefit versus MK7. So I would say if you're wanting to switch, do the Megaquin D3. So you have the combination of the K2 and the D3.
Okay. Reba, I'm glad you're in the chat. Clarissa will help. Okay. Okay. Did I already ask you this? No. What is the difference between the phytonadione, oh my gosh, FOM, and the Megaquin Gold? Do you have any idea what I'm talking about?
I'd have to see what the P is are they two different forms? Because the Megacoin Gold is the branded K2 that I was mentioning that is our K2. It's our branded K2
Right.
that's that fermentation from chickpea. There are other companies will use other types of MK7 or they'll use MK4. And so some of those other branded names might be a different form of K2
Okay.
that they're using.
If someone's in remission for SIBO and suspect their relapse could be anxiety, okay. If you're in remission from SIBO and suspect their relapse cause could be anxiety and intrusive thoughts, what supplements would you recommend to keep relaxing? Hey, Christopher, can I just say something before you do? And I can't wait to hear what you have to say. I don't really see the anxiety as being an underlying cause. I think it can contribute to like your vagus nerve not being regulated and things like that. So I want to ask you about, have you had food poisoning lately? Like, why else are you on a prokinetic? Why else do you think that it may have relapsed? And yes, it does lead to a lot of brain fog and anxiety. That can definitely happen, but I want to look at a couple more underlying causes for you.
Yeah, I would agree with that. Usually anxiety is going to be a symptom of maybe SIBO, or it's going to be a side effect. It usually isn't going to be the only cause. There's going to be something else that's caused that relapse that could maybe also be contributing to dysbiosis, which could then be causing anxiety. So I'd be looking a little bit more into that too.
And I'm sorry you're going through that, but I really
Yeah.
hope you're on a prokinetic. Okay, any best time? We have 1 minute left. Any best time of day to take K2?
Nope. Anytime.
Anytime. Okay. We already did that one. Let's see. I think I did that one. I did that one. Woo! Does Microbiome Labs offer calcium capsules, tablets to take with K2 and D3?
Not at this time. No.
Nope. Okay. I think we did that one. Any studies of aortic stenosis calcium scores going down after K2 supplementation?
Yeah, I'd have to dig into the research. Like I said, anecdotally, I've seen that.
Yeah.
So yeah.
Okay. Let's see. Kim, I don't know if it would be safe for a triple bypass person. I'm so sorry. And I mean, obviously, I'm so glad that they had a successful triple bypass, but this would be something that, like, that's a serious scenario. So talk to your doctor. Okay. Okay. Oh my gosh. Okay. So thank you. The code worked for you, Reba. That's great. Sleep and Cope, the Zen Sleep and Zen Cope are phenomenal, by the way, Christopher, for anxiety. We did one of those recently, one of those workshops, webinars. And when I'll just confirm this, Clarissa, that we're still doing this. When we send you all the replay, it's usually stacked with the other videos that we've done with Microbiome Lab. So like you can scroll through there and see all kinds of information. And last month we did it on the Zen Biome Cope and the sleep and etc. And these are studied probiotics that actually like give you a result. Like the sleep was improved within 20 minutes, like wild and wonderful. It's a brave new world. So definitely check that out. Do you take it with food? And then we're going to wrap up. Thank you for being here, everybody. You want to pop some love into the chat for Alicia? We'd love to have that. And with food?
Yes, you can take it with food or without, but preferably with food.
Okay. I just look at this for a second and I'm going to directly message you, Alicia, for this because there's that one question with the pH. I'm not sure if that's like you're up your alley or not.
Oh, so it's an MK, so it's going to be a synthetic. The MK, anything MK4s will be synthetic. So it'll be in that cyst form that I was talking about, where your body's kind
Cindy
of
and
like,
Mike,
oh,
this is for you. So
yeah.
okay. All right, we're going for the natural. Okay, thank you all so much. We are thrilled that you were here. Be sure to take advantage of the No Bloat 15, and you can do that for anything, including Megaspore on Microbiome Labs website. We thank you so much for that. And use the patient direct code SIBO SOS. And then lots more in store for you all with more webinars coming up, etc. And don't forget that my Gut Summit, the Gut Rescue Summit, an evidence-based approach to finally get your health back, which Alicia is in, is coming on live March 11th. But if you pre-register for it now, it's free while we're doing the premiere and the launch March 11th. You can preview 3 different videos, like just kind of prime the pump. But that is all evidence-based. So if you love these types of webinars and masterclasses, the entire summit, there's like 40 plus speakers, I asked each one of them to provide at least 3 studies. So, and of course, clinical experience, because you don't just need a double-blind study to prove something works, obviously. So it's the best of both worlds. So I don't know, Clarissa, if you have the opportunity to pop the link for that in the chat, but everyone's going to get an email about it for sure. And so I hope you'll join me for that, including we have webinars coming up. Alicia should definitely join us for this with Dr. Ali Razai of Cedars-Sinai, who's he with Dr. Mark Pimentel will also be one of our Q&A sessions. They're mapping the small intestine microbiome. It is so cool. It's
Very
so
cool.
exciting.
Yeah, very, very cool.
Yeah. Okay. Thank you. I don't
Thank
want
you.
to thank Christopher, but I love you for that. That's very sweet of you. Okay. Okay. Good, Hilde. Okay. That's it. Thanks, everybody. Mwah. And
Thanks,
you know what?
everyone.
Thank you so much. You did a great job as always. As always. Check your emails for the summit link. We'll send you some. Okay. Take care, everybody. Bye.
Thank you.
Bye.
Bye-bye.
Thank you. Great job.